I've had a change in my bowel habits. Should I be concerned? Find out on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello and welcome to Digest This. I'm Dr. Liz Cruz and I've got Tina Nunziato sitting right here by my side. Thank you so much for joining us. If you are a first-time listener, we welcome you. And if you're one of our regular listeners, we love you and we appreciate that you have continued to take time out of your busy schedules every week to hang out with us and to either listen to us or watch us on YouTube. And so thank you very much. We appreciate it. So let's talk about a change in bowel habits. Tina, how did this topic come up?
So we actually did a podcast back in 2015, a GI focus
10 years ago.
Change in bowel habits. I can't
Wow.
believe it's been 10 years.
Yeah.
But this podcast came up because there was an article that came out on an actor, James Van Der Beek, who's the Dawson Creek actor. And he was recently diagnosed with colon cancer, and the only signal for him was change in bowel habits, and that he didn't realize that a change in bowel habits from what he was experiencing could mean colon cancer. So I thought it would be a really good podcast because there are a lot of people out there that might have a change in bowel habits that maybe equate it to something else, maybe a diet change or a shift in something, and they don't even think that it could be colon cancer. And these are people that probably have never had a colonoscopy. So just, again, more of trying to get the word out to people to don't be scared about getting your colonoscopy.
That's it. We're done. Thank you very much for joining us.
I know, right?
Yeah, no, I think that it's a very important topic as a gastroenterologist because it is a red flag. Having a change in bowel habits is an absolute red flag. And anytime anyone comes into the office, and if that is marked on their intake, I always will question them about that and try to figure out, what's happened with their bowel movements. So what does that mean? A change in bowel habits. So let's say that you're someone who's used to having a nice regular bowel movement, maybe 1 or 2 a day. And all of a sudden, over the last month or so, you've noticed that you're not having bowel movements like you used to. And something is different. All of a sudden, you're going 2 days without a bowel movement. That's a change in bowel habits. It is definitely a change in bowel habits. Let's say that maybe you notice that the caliber of your stool is different. All right. Like maybe you have a nice round bowel movement, nice girth to it every day, maybe 2-3 times a day. And now all of a sudden you notice that the girth, the caliber of your stool is maybe the size of a pencil, or just, it could be a little bit bigger, but that it's definitely changed. That's also a change in bowel habits, a change in caliber of the stool. And all of those things should definitely alarm you to think, hey, something's not right. It does get a little tricky if you've had some major changes in your diet. Like all of a sudden, you go from eating whatever, and now you decided to get on some diet that is just mainly protein heavy, a protein heavy diet. You are going to have a change in your bowel habits. But so the tricky part is, if you do all of a sudden have a change, is it the diet, or is it because there's something going on? Is that change that's occurred a red flag that there's something brewing in your colon? And, the concern is always cancer. That's always cancer. So when I was in my training and they were teaching us, we were doing our teaching, when we were talking about colon cancer, the question was always, well, what is the sign? What are some of the symptoms or the signs that would make us think that something is not right? There could be a cancer in there. And one of the big ones was a change in bowel habits. Also, someone who all of a sudden has a new onset of anemia, or someone who's become fatigued because maybe they're becoming anemic, okay? Where would that anemia be coming from? Well, if you have a tumor growing in your colon, you could be losing blood from that. And you may not necessarily see the blood because you may just be losing very microscopic amounts of blood, but over the course of time, enough to the point where you start feeling tired and fatigued, you have low energy, and you get some blood work done, and lo and behold, you have anemia. So that's definitely a red flag. Like we just said, a change in bowel habits is a huge red flag. If you start seeing blood in your stool, and
sure.
that for sure is a red flag.
Yeah.
And so those are just a few of the red flags that can't be ignored, that need to be, you need to be aware of some of these things. And if you ever experience any of that, you need to get yourself over to a gastroenterologist right away and get a colonoscopy done, especially if you've never had one done. And just a reminder that the age used to be 50, but that got changed. Oh my
Years
goodness.
ago.
I think it was like maybe 2018, that recommendation got changed to 45. So the age at which we now recommend having your first screening colonoscopy is 45 years old.
And they did that because there were so many people being diagnosed
Yeah.
with colon cancer by the time they hit 50.
Absolutely.
And that was the one thing James Van Der Beek said in the article, was that he didn't realize the age was 45 because he should have then had his years ago. And he was, I think it was coffee drinking for him, where he had increased his coffee drinking and that had changed his bowel habits. And so he felt he had related it to the coffee drinking. And he didn't even think about it. But when he went in for the colonoscopy, he ended up with stage 3 colon cancer.
Wow.
Which is just incredible to think that. And he felt like he was in the best shape of his life. He said he was doing cold plunges, he was exercising. He felt like from a cardiovascular standpoint, he was in the best shape of his life. And then to have all this other stuff going on and then to be diagnosed with stage 3 colon cancer. I think for me, the most frustrating thing with patients being diagnosed with colon cancer is that a colonoscopy is so simple. But people avoid it. They try to do everything else except get the colonoscopy. They're like, oh, I'll do the poop smear, the Cologuard. And look, this is such a simple cancer to prevent, and all you have to do is get a colonoscopy. And I don't know why people are still so afraid of the colonoscopy.
Yeah.
Because they were talking about in the article, there was a bunch of GI doctors that were being quoted in the article, and they were talking about how there's still not, like, in terms of the percentages of people that are 45 and up that have not had their colonoscopy is still very, very high. People are still not going for these screenings. And it just boggles my mind how we could not be doing something as simple as a colonoscopy.
Well, I think a lot of people also don't know. And so there's been a huge push, in the medical community to try to get the word out there. The gatekeeper is typically the primary care doc, and they're the ones that, will typically tell the patient, hey, you're due for a colonoscopy. But I can't tell you how many patients I've done a colonoscopy on who maybe are in their 60s or 70s. And I'm like, oh, this is your first colonoscopy. They're like, yeah, I didn't know, that I had to have this done. And much less, I didn't even know the age was 45. So believe it or not, there is still an unknown out there as to the age for colonoscopy, which is 45. Unless you have family history, then that could change that recommendation. But if you have, assuming you're not having any issues, assuming you don't have any family history, the standard age for starting is 45 years old. And who knows, I've heard talk that maybe they would even lower that even to a younger age. But at this point, it's 45 years old. And having a colonoscopy, I mean, yes, getting ready for it, prepping the night before, drinking all that liquid, it's no fun. But I'll tell you what's no fun is getting a diagnosis of colon cancer. And now having to have, surgery or chemotherapy or radiation or all of them, or, now you're on a totally different pathway. So the torture of having to drink a prep the night before definitely outweighs the torture of being told that you have colon cancer. Okay. I mean, there's not even a comparison. There's no comparison. You get in there, get your colonoscopy done. You're always, sedated. So you're not even aware of what's happening, and you could save your life. And so if you are at that age, or maybe even older, and you've never had a colonoscopy, please get in to see a gastroenterologist, get your colonoscopy done. If you have loved ones, friends, family that are 45 and have never had a colonoscopy, please encourage them to get in there and get their colonoscopy done. And if you've had a change in bowel habits, don't ignore that, because that is definitely considered an alarm or a red flag. For me as a gastroenterologist, if anyone ever tells me, that they've had a change in bowel habits, they're getting a colonoscopy. All right?
Yeah.
All right. So if you haven't connected with us, please connect with us. Go to our website, drlizcruz.com. There's a magenta color button on the homepage. You can click that and schedule a free 30-minute wellness consult. If you have not subscribed to this podcast, please subscribe so that you never miss an episode. And if you haven't rated us, please rate us and please give us a 5. It'll help other people just like you to find us faster. Thank you so much for joining us, and we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.